I say, it's a closed group, then we can scale up actually. So voilà, the panel is on to have a brief round table for the presentation. Just please, Bob, can you introduce yourself? Can you hear me?
Yeah, Robert Font. I'm the executive director of IVRA, the International VR and Healthcare Association, which we started back in 2019. And I'm based in Washington, D.C.
Okay, thank you. Laureline?
Oh, I don't know. I think it works.
What?
Hello, everyone. I'm Laureline Comte, and I'm the healthcare directress of France Immersive Learning and Immersive Learning Lab. Actually, I was a nurse for maybe 10 years, about 10 years, and I was specialized in I don't know the word in English for that, but
C'est en quoi?
pour l'accompagnement patient.
Okay.
Massotherapist things, so like reflexology and Chinese medicine, but for patient who has oncologic problem and end of life condition.
Thank you. And then for the three other one that has been also speakers before, so you have Lars.
Yeah, hi, I'm Lars Wiedemann. I'm a medical doctor and scientist at the Heidelberg University and running the Medical Extended Reality Accelerator in Heidelberg. Hi, Bob.
Frank?
Hi, so I'm Frank. I used to be physical therapist, and I'm the founder and CEO of Virtualis. We do VR for physical therapy and occupational therapy rehabilitation.
And then we have Xavier, right? We can have a share screen? No, we can have them both at the same time?
I'm not sure.
Okay, d'accord.
No problem.
D'accord.
Voilà. There I am. So I am Xavier Abadi from Sim for Health, and I'm the international director at Sim for Health.
Okay, so the idea of the panel is to talk how to scale up. We have different presentation. We can see the usage, the practical cases, point of view from the workforce, like from a physiotherapist, a doctor. Now we have you as a nurse. Can you tell us how to scale up? Basically, what's your idea just about that?
Actually, it's really fun because there just a few weeks ago, we just answered to an appel à projet, to an offer, and that's the question that we had to answer. So actually, we identified 3 points very important. The first one was we have to gather the ecosystem of healthcare VR in France. And here I will speak about how to scale in France, because we have a lot of we take a lot of late like on this subject, so it's very hard to take the train that UK and US took before us. So in France, we have to really to gather the healthcare ecosystem to be visible at the national and international term. And then we have to acculturate, to educate the healthcare teams and the healthcare giver, because they don't know what we are talking about. And that's what you say. Hospital today, they don't know us, they don't know VR and XR, they don't really know what is it. It's toy, it's okay, it's just something, we don't know what is it. So we have to educate them of what we are talking about, how strategic is this field. And then we need help in financial way, because producers in France, there is a lot of them. They are making some wonderful things, but we can see them, and they have not enough money to do big things. So there's some who has more for those who it's easier for them, like for Sim, because Sim for Health has a lot of experience, but a lot of them are really little and need to have visibility and
more
financial
visibility. Yes.
and
So
financial
3
help.
point, it's education,
Yeah,
visibility, and finance.
I think so.
And
3 major one, and
yeah,
then we have
voilà.
the little.
Yeah, the cost. So, from your perspective, based on
I think countries are really different. In France, we like it, we buy it. It's quite easy, and in the physical therapy market, as I know him, and ENT doctors, because we treat balance disorders as well. So in France, we have a real community for vestibular physical therapists, but outside France, it's ENT doctors who take care of balance disorders. So in France, I think the market is quite easy. It's, of course, education of the therapist, but outside France, especially in the US, we really need to have publications, because even if the publication is not a real good quality paper, as long as it's not published in the US, it's not real, it doesn't exist. And it's difficult for a hospital to buy something if it hasn't been published. So they use only very standardized protocols. So we need to incorporate protocols in all our software for rehabilitation. Otherwise, they don't think, oh, this is nice, I could use that with my patient. No, they think like, I will use this protocol because I have this proof that on a clinical study, even with 10 patients, it has shown results. In the US, it's very publication. So clinical studies are very long, because you need to write the paper, to have the authorization, to gather the patients, then to analyze all the data and publish. So it takes 2-3 years. And of course, in 2-3 years, software change, technology changes. So we need to run after publications. It's a little bit difficult. And to education of the market, of course. In France, I think it's easier.
So back to the question how to scale up. On the 3 top from Laureline, you add the credit from the official study.
Exactly.
And to scale up, it's to go overseas. So you need the credit from overseas to get back with the product in France? Is that what you say?
Yeah, in France as well. As soon as it's published, it's better and it's easier to show the results. It's not only a video, it's a published paper. So I think for most use case, nursery, surgery, anything, it really needs to be published, and it takes time, money. If you are lucky enough to know all these researchers and to try to get behind all the funding of the publication, usually a company would have to buy a clinical study. But if you know them and you develop something for them, it can be faster and easier. But it's this access to research that's a little bit difficult, and that brings more value to your product.
Okay. Lars?
Yeah, I think all the points are very valid and very much needed. What I think is needed is a very strategic approach. I've been advising a lot of companies over the last years, and to me it's very surprising that every company tries to tackle these problems by themselves, and they do the same mistakes like the company last year, like that company did the year before, and they always try to solve all the problems by themselves, and there is not a real clear path forward. Like sometimes they don't even know what is the next step they would have to take, so they just end up there by accident. And I think what I would wish for is a strategic pipeline where companies at different points in this development process know exactly what's the next step, what's needed. Like you said, publications are needed. How do I get there? Who do I talk to? On the same awareness, education. Who do I talk to? When can I educate them? How do I get access?
Yeah, a clear strategic path.
Yes.
Okay. Bob, can you hear us?
Yeah, I'm here.
Did you get everything since the beginning?
Yeah, perfectly clear.
What's your point of view, or what can you think from states with your perspectives from overseas actually?
Yeah, well, you're asking the hardest question, of course, and it's something that we have been thinking through every day, week in, week out for the last 2 or 3 years. Is how do you grow the market? And at the end of the day, it still is about education and exposure of VR to the masses, and that includes general healthcare practitioners. So I do think everything happens a little bit faster once people have experienced VR, for the first or second time, once they've had a good experience. And once you have that understanding, and the healthcare practitioners very quickly can go from point A to point B and understand the implications once they have had the experience and see it, and then they will drive the interest and the uptake internally, and you'll get those champions. So the challenge really is reaching those individuals and giving them their first experience. Mm-hmm. And we're trying to come up with different models on, do we go hospital by hospital and do a VR fair for a day and try to expose as many people as we can to give them different experiences, and it's just a lot of ground to cover. I think also we definitely need a second mass market competitor in the environment, beyond Facebook, Oculus. We do have other competing platforms. We've got Pico, and we have options for companies to get uptake. But if we want more mainstream adoption, we definitely need a second competitor in the consumer marketplace.
Right. Thank you, Bob. Xavier?
Well,
wait.
A lot have been said, and I share pretty much, I share everything that has been said by all the different panelists. I would add 2 other things, and actually to just say what you were saying, try to go to each and every hospital and do some kind of VR fair. That's exactly what we did at SimForHealth at the first year in France. We did what we call the Tour de France of medical simulation, and one of our colleagues with a car and a VR headsets went into the different medical schools in the different universities in France. There are, I think, 38, as far as I remember, to spend a couple of hours there and to expose all the students and the teachers and the academic environments to the technology. I guess it's also a matter of getting the right use cases and the right model. When we worked with the nursing schools in France, and as I said, the nursing schools in France are managed by the regions, and so in our region in the southwest of France, which is Nouvelle-Aquitaine, we have 27 nursing schools. And we worked on the content with the teachers. We work on the contents with the nursing teachers, educators, and we spent, which was a lot of time for a very small company as ours, we spent 18 months doing that. The result of that is that the 2 modules that we have in VR have been co-created with actual nurses, actual teachers, and so they're fully adapted to their teaching goals, their teaching strategies. And we have all the 27 schools in Nouvelle-Aquitaine that are equipped with VR helmets. So it's kind of funny to see that some very small schools that are, I don't know, they have 80 students. It's a 3-year course in France, so they have like, I don't know, 80 students altogether in a very small city that has less than 10,000 inhabitants, has got their own VR headsets, and they actually use it for specific modules and specific trainings. So I guess this is very important to have these kind of contents that can be deployed on a national or international, although this can be discussed, basis. And yeah, that works.
So what you're saying is not the amount of people, but it needs to come with an experience from the bottom.
Yeah.
Yeah, definitely.
Also, yeah.
Voilà. So I think we are quite all aware about where are the problem and where we can find a solution, and building, as you say, a strategic pipeline can help us by just sharing like we're doing now, like how to be successful, how to empower each other. It needs to happen, like as you say, as a consortium, as a group. Does anyone want to ask a question, or do you have a specific? Yes?
Yeah, I was wondering, because you were talking about ethical commissions in universities. Do we have stuff like equivalent in France to people we can talk to, easily access to make sure what we're developing is correct? I don't know if we have this. How can we find these people? And yeah, does it exist? Is there like a consortium in France?
Can you answer that? One of you?
I can't.
Actually, some years ago, VR Connection had put a consortium of many experts in ethics, and they made a chart of ethics for XR. But it was some years ago. I think I remember that last year they update the document, but it's still a lot of work to do, and it's a lot of questions still to answer. So work in progress in France.
And actually, normally there's there's an ethical committee in each hospital in France, and normally the address and the people in charge can be found on the hospital websites.
Yeah, and just to complete, we have the CNIL in France. It's not exactly ethics like a moral and something like that, but on data privacy, data policies, CNIL do that.
Yeah, but actually for CNIL, they are not specialists on XR yet, and it's work in progress.
But yes, it's work in progress.
Yeah.
For research, there's always an ethic committee to validate the research. Otherwise, it's biomedical engineers and quality manager on the hospitals. But I think as long as you don't open something, it's just for us a rehabilitation tool or training tool or whatever. It doesn't touch really these ethical questions.
Maybe not.
We never faced any difficulty with ethical departments in hospitals, and we sold to a lot of hospitals in France. Rehabilitation is maybe somewhere different than medical part.
Another question? No? What I thought when I listen all of you, it's to wrap up this panel will be like, what do you think as a concrete step we could like, what's the next step that you're gonna do tomorrow to be more involved as you already are? The one thing that I want to add, it's like for the presentation, the room was really packed at some point, and they were really interested. So now it shows that it's not necessary that what we are sharing is not interesting, but it shows as well that the difficulties that it brings to make the first step is to understand each other and see the need of each other. So what do you think, Lauren?
I don't know for those who are already gone. Oh, sorry. I don't know for those who are already gone. Maybe the subject of how to scale up are already clear for them. For French immersive learning, the next step will be the achievement of the consortium for the offer that we talked just before. We just made a big consortium with APHP and other big hospital in France, and with some very good producers. And actually, the idea is to gather a lot of good producers of content to get them in some kind of package for the hospital, to get them like everyone in one step, and to be visible there and make the proof that it works and it can be replicable in every hospital we need.
So a table of experts that you work together for projects within the hospital, right?
Yeah, we make a consortium, and we want to package all the license we have for the hospital, so they can educate their healthcare giver to do that. But maybe you can come to the B51 to see what we learn if you're interested, because here it's a little bit complicated to explain. So
thank you.
It'll be better.
Lars?
That's a difficult question because there's so many things we should do now. But what we will do on the 1st of January next year, we will offer every medical XR company a very clear pathway to high quality research and to this very strong network to actually achieve the highest quality of research. And like you said, without proper publications, I don't see a path forward, especially not towards full reimbursement by health insurance companies. So we will offer that to the industry.
Okay. Thank you, Lars. Who wants to go first?
30 seconds. I would say to go faster than publications, the best process for us is to go through key opinion leaders, well-known professors. We work with them, and during congresses, they talk about what we do, and that's the easy access to wider, let's say, market, even if they are therapists, but either publication or communication with key opinion leaders. That's the best way to go fast.
Thank you, Franck. Xavier?
Well, as far as we're concerned, continue to work on quality contents, quality training contents, with, as which has been said by Franck, key opinion leaders, and yeah, try to be as accurate as possible in terms of what we bring into training experience. We didn't mention either all the new technologies in terms of headsets, especially it's not exactly new, but the standalone helmets that are, I think, very important to the rise and the scaling up of the VR industry. We have to get rid of all the cables and everything that makes it, or does make it seem like it's difficult or too technical for people to use it.
Okay, thank you very much, Xavier. And last but not least, for the 10 last seconds, Bob.
Actually, so I think it's safe to assume that each city in the United States, Europe, elsewhere, has a strong handful of folks, let's say 5, 10, experts in VR healthcare that are kind of pushing the envelope at one hospital or university or it's a company. We need a local champion in each of those cities that can start scaling up locally and start bringing education to other hospitals and other institutions within their city. if we can start to help support and identify those people, I think that's one way of scaling up a bit faster.
Okay, thank you very much. Thank you, Bob. Thank you very much, everyone. And now, let's go for the award.